All right. Hello, everyone. Welcome to Moms in the Middle. I am flying solo this week, except I do have Dr. Meg Schwartz with me. She is a doctor of physical therapy, specializing in pelvic health, and a certified functional medicine health coach. So, welcome, Dr. Meg.
Thank you. Thank you for having me. I feel
Yeah.
honored to be here, so I'm excited.
Yeah, I'm so excited. This is something I think is really, I'm excited for this topic because I will say, admittedly, I did not think much about pelvic health, like, until I was pregnant with my second.
Mm-hmm. Yep.
Like, it just was not talked about. Like, I also was not in the, like, birth world like I am now. So, obviously, it's more, like, in my algorithm and, like, in my face all the time. And I feel passionate about it more now than I did then. But yeah, like, I just never really knew much about, I didn't even know pelvic floor physical therapy was a thing.
Mm-hmm.
Like, I just didn't.
And
And
your story isn't unique, so I hear
yeah.
that all the time with my patients. A lot of times they won't even have an understanding of this until after, and it's usually once we start having complications that then something happens. This is definitely a world where prevention is not necessarily the standard.
Mm-hmm.
And it's more of, oh, I'm starting to pee when I'm running, or I'm noticing my back is hurting, or it's hurting with I'm having intercourse with my husband now.
Mm-hmm.
Then they'll start to get
Yeah.
into
Yeah. And so much of, like, what those issues, a lot of that is brushed off as, oh, that's just part of it. That's
it.
part of being postpartum. That's part of aging. It's part of menopause. Like,
Being a
whatever.
woman.
What'd you say?
Being a woman.
Yeah. Part of being a woman. Yeah.
Yeah.
So it's just so interesting. And obviously, like, I came to you, and you have opened my eyes to all the things, and it's just amazing. And as a doula, like, we do talk with our clients a lot about pelvic floor health, but, like, there's just so much to know, and it's just like you can't possibly teach someone everything. But yeah, so tell me a little bit, or tell our listeners a little bit about what got you kind of into, one, just physical therapy, and then, like, that world, and then what kind of drives your passion for pelvic floor health and women's health and all of that.
Absolutely. So I feel like I have a pretty standard story for how I got into physical therapy. I was an athlete in college and got hurt and went to physical therapy and always thought that I would end up in outpatient orthopedics working with athletes in that regard.
What sports did you play?
I played volleyball in
Okay.
college. So, yeah.
Yeah.
So ended up with a back injury, went to PT for that, and then decided to do what helped me.
Yeah.
So then my journey into, like, pelvic health specifically, so I actually started off as a travel physical therapist. So I was in all different kinds of settings. So I was in skilled nursing, I was in home health, outpatient, acute care. And so that was kind of when I really started to look into more of, like, a functional, holistic, treating a whole person aspect. I just kept seeing, like, and I was in skilled nursing in COVID, and seeing how much the mind and the body couldn't be disconnected, even in that setting. So I said, even my patients who didn't die from COVID in the nursing facility died from COVID because they were alone in their rooms. They weren't able to get out and move their bodies. And then I just kept seeing that so many of my patients, when something would happen, all we would do was throw a medicine at them. Mm-hmm. And then it was like they were getting meds for the side effects of the meds. And it just seemed like this, like, vicious process.
Spirals.
Yeah. And so I started getting really curious about, like, holistic health and treating the entire person. So I always knew that I eventually wanted to get back into like an outpatient setting. And then I kind of started having my own issues with, like, the medical system and being a woman. And I remember going to my OB. I had just recently gotten an IUD, and I started having all of these like mood swings, and it was so crazy. Like I felt crazy. I would start having like panic attacks like 2 weeks before my period. And then the week before I would get like really depressed. And that was when I first like really started tracking my cycle, because
Mm-hmm.
it felt like it was happening way too often. And that had never happened to me in the past.
Yeah.
And so then I talked to my OB about it, and she told me that there was no way that that could be a possibility, um, because of how the marina worked. It would just be a localized effect, which now knowing what I know, it that is probably true for most people. But these symptoms started, and we we're all different, and how things affect us is all different.
Mm-hmm.
So, um, what she ended up doing was just prescribing me Prozac for the 2 weeks leading up to my period. And at that point, I was just like, it felt like I got hit, like I ran into a wall, and I was just like,
Yeah.
how is this the answer?
Yeah. Like, here's
I,
a band-aid.
yeah. And I'm like, I don't understand why, like, we consider this to be normal. Like, why does my life have to be impacted? Why does this have to suck just
Mhm.
because I'm a female and I have like this reproductive system? I was like, that doesn't
Yeah.
make sense to me. So I started talking to other women about it. And the more that I kept talking to other women, the more I would hear about the medical system just like undermining their symptoms, or telling them that they're crazy, or, the whole you're peeing your pants, it's normal, you just had a baby,
Mm-hmm.
all of those kinds of things. And so
It's
that was,
frustrating.
yeah, it is. And I feel like it makes us doubt our intuition.
Mm-hmm.
And we know our bodies, or we should know our bodies, and that feeling of not trusting your instinct in your own body is not a good feeling.
No. No.
Yeah. So that was really when I became really passionate about women and the healthcare system that we live in.
Yeah.
So then I kind of dove into this world, and it's been the perfect fit. It's exactly where I'm supposed to be.
Yeah, for sure. For sure. It's so amazing how our own experiences kind of shape like where we end up and what we end up doing. I know that like in our world, like obviously our professions are very different, but we're here because of our own personal experiences and like the things that we've learned through that and the research we've done through that and all of that. And it is just so frustrating. I know through like our infertility battle, found myself kind of in the same boat, like asking questions like why? Like, yes,
Yeah.
I know that, this treatment fixed or, resolved, ended up in pregnancy, like, IVF. Yes, I got pregnant with that. But like, why couldn't I have got pregnant before?
Yeah.
Like, and I know that there are always going to be things that are unexplained, but it just never felt like we really dug deep. Like, okay, yeah, we probably should figure that out. Like, there's probably something going on, but there was never, it was just like, well, you're pregnant now, healthy pregnancy, don't worry about it, and we'll do IVF the next time if you need, when you're ready to get pregnant again. And it's just like, but why can't we fix the underlying cause? Like, why can we not find a way? And it's just, I could go on a whole tangent, but we know that like our medical care system is not set up for that. And that's what's unfortunate about it. And so when it comes to kind of where do you see most people coming to you? Like postpartum is my guess most of the time.
So, yes, I would say postpartum usually, if they tend to be in this world. So even like if they have been to a chiropractor,
Mm-hmm.
or if they start having issues when they're pregnant. So if they start having back pain, if they start leaking during pregnancy, if they have pubic bone pain, sometimes we'll see them during pregnancy.
Yeah.
But I would say a majority of my patients, in the pregnancy, postpartum, like that, kind of like lifespan,
Category group. Yeah.
yeah, um, would be postpartum. And it's always interesting to me when I see my postpartum patients, because we will go through in every single one of my evaluations, I do like an overview of the pelvis, the pelvic floor, the functions of the pelvic floor. And this was an area that was so crucial in birth. Even if you have a C-section, like this is still whatever that birth journey looks like, this area of our body is still totally affected. And so they've just had this major trauma to this tissue. And every single time I educate on this area of the body, they're amazed at how crucial it is to our function, to our life. And they have no idea.
Mm-hmm.
This was information that should have been given to us even before we're thinking about babies. Like,
Absolutely.
we need to be better in tune with our bodies, even like when we start our periods and all of that kind of stuff.
Yeah.
So
yeah, it's just so unfortunate. It's like, how do we fix that?
I know.
Like, how do we fix that? Because it usually takes something like that, something being wrong, for us to like actually figure out, okay, like now I'm, learning about my reproductive system and my hormones and my pelvic floor and all of those things. It's just like, wow, how come no one has talked to me about this?
Right. And that question, the amount of times I should start like tracking that question, why has nobody ever said anything? And not just with my postpartum or pregnant patients, it's with my bowel patients, it's with my cancer patients, it's with male patients even, I mean, nobody talks about this part of our body. And I think that there's part of it that there's a lot of shame in this area of our body. Especially as women, we grow up like, women don't fart, they don't poop, we don't talk about peeing, like, you don't talk about sex, you don't talk about intercourse, any of that kind of stuff. And so I think that there's a layer of that to it too.
All of that's a taboo topic. That
But then you want to become pregnant, so obviously this is something that has to happen, right? And then we have all of this dysfunction, but have never even thought about what, like, women don't even look at their vulvas typically before birth, before even after birth. Women don't look at this part of our body.
Yeah. So I know personally, I've had clients that I'm like, you really need to get familiar with that area, and it's like they're so taken aback and like mortified by the idea of that. I'm like, you're about to have a baby come out of there.
Right. Right.
There's about to be a lot of things happening, and more often than not, a lot of people looking at that thing, like.
Right. If all of these people are going to be looking at it, but you've never seen it, like, what?
I mean, I've had clients who have never even had a like pelvic exam, and I'm always blown away. I'm like, oh my gosh, you're like in your mid-20s. You've never had a pelvic exam. They're like, well, yeah, like I just didn't know I needed one. And it's, you don't know what you don't know. It's not it's not their fault. But I'm just like, oh my goodness, like we have so much to catch up on before this baby arrives. And then you're dealing with all of the things in that area. And it's so crazy. It's so crazy.
I know. And that's what I tell my patients too, is like, if you don't know your anatomy, if you don't know your own body, how do you expect somebody else to know it? How do you expect to go into your gyno and say there's a problem, or look at this looks different, if you've never seen it before? So it gives you a sense of empowerment to know your body. We should know this. And it shouldn't be a shameful or, like, you shouldn't feel guilty about looking at a part of your body. Like, you live with this every single day.
Yeah.
And in order to advocate for yourself in this medical system, you being an expert on you is the best way to do that.
Yeah, you hit the nail on the head there. Like, you have to, unfortunately, like we have to be our own best advocates. And you just really can't do that unless you know what's going on. And part of my certification is in fertility because of my history. That was really important to me. And most of that is cycle tracking and, just understanding your cycle and the hormones that cause you to ovulate and all of that. And you know, again, before I was immersed into that, like through my fertility journey, I had no idea. I had never
Absolutely.
thought about it, you know? But then after I had done the cycle tracking and I had really gotten in tune with what was happening, I was able to tell my doctor, like, hey, I noticed this. And even now, you know, years later, able to say, like, hey, I noticed this was my cycle. Like, that's not normal for me. It might
Right.
be normal for other people. It is not normal for me. Like, what is going on? What do I need to be doing? You know?
Absolutely. And that's the other thing is like, I mean, women are very out of touch with our bodies just as a culture because our bodies start telling us stuff like during menstruation. Like when we first start getting our periods, that is like a balance sheet of what's
Mm-hmm.
happening in your body. If you're having crazy bleeding during your cycle, that is not normal. If you are
Mm-hmm.
having debilitating cramps during your cycle, that is not normal. That is your body telling you it's needing something or it's missing something.
Yeah.
But what we do is we cover up and stop letting our bodies talk to us. And like whether that's with birth control or like an antidepressant or whatever it is, we lose that connection to our body. And I'm
Yeah.
not saying like I'm not like, you know, saying don't get on birth control, don't need any of these things, but like women need to understand and be educated so that way we can make the best decisions for ourselves instead of
Right.
letting our healthcare providers make them for us or yeah.
Yeah. Yeah. So, obviously, there's lots of benefits with pelvic floor physical therapy when it comes to like all seasons of life as a woman. But let's talk specifically about during pregnancy. Like, what are you focusing on? What are the benefits that you see during pregnancy?
Yeah. So if somebody comes to me and they're having some sort of dysfunction already, definitely focusing on that. But primarily what I'm looking for when I see somebody in pregnancy is are the parts that like need to be moving when you're trying to push a baby out, can we move those? So like your hips. So if we're working on we need to get mobility in the hips into like external rotation so we open the like top part of the pelvis so the baby can come into the pelvis, right? So we need to make sure that your hips can do that. We need to work the hips into internal rotation so the bottom part of the pelvis can open so baby can come out, right?
Mm-hmm.
Which that is the motion that tends to be very very tight and restricted during pregnancy, which is where we tend to get a lot of issues with that bottom part of the pelvis opening up to allow for the baby to come out. So,
Mm-hmm.
really focusing on that. The other thing that I would say during pregnancy is so making sure that you're connected to the pelvic floor. So, our pelvic floor is just like any other muscle in our entire body, right? So, like, I need to be able to bend my arm fully and I need to be able to straighten my arm fully. So, for your pelvic floor, you need to be able to pick it up, lift it fully, and then you need to be able to relax it back down the entire way. So, making sure you're staying connected to that throughout this process. Um,
Which is really hard, by the way.
yes, yes, it is. And it's so crazy because it's never something we think about before.
Mm-hmm.
But when we have a baby, I always explain it to my patients this way. It's like your pelvic floor, it's like you holding like a 5-pound dumbbell in your hand all day, right? So eventually that muscle is going to get really tired. It's going to give out maybe, right? So we'll get some leaking, or it just gets like you get knots in it. So there's tension in it. So making sure that we're getting that full range of motion of the pelvic floor to support you, your baby, your back, everything.
Mm-hmm.
Um, so it's not just about Kegels, right? So we need to be able to activate the pelvic floor, but in order to have a baby, your pelvic floor is not doing any of the work. Your uterus is what's contracting to push your baby out. Your pelvic floor has to open up to allow for that to happen. So we need your body to be able to relax into that. So working on that relaxation phase in order to allow your uterus to push the baby out is really,
Mm-hmm.
really important. So as far as like a strengthening perspective, staying connected to your core and your glutes. Those are the two things that we lose during pregnancy because of the posture of pregnancy.
Yeah.
Um, so yeah, and then obviously getting some sort of birth education. Like, you guys do a fantastic job with what that birth will look like, all of that.
Mhm.
But I work with my patients on like practicing pushing, um,
Right.
and the positions that you're going to practice pushing in too, because it's just like a sporting event or a musical performance.
Oh
You're
yeah.
going to play like you practice. So if you don't ever practice, then when it comes to game time, your body's not going to remember what to do.
Yeah, and it's just like you said, it's something we've never really thought about before.
Mm-hmm.
And breathing in a way that supports your pelvic floor, and when with certain types of movement, like all of that is,
Mm-hmm.
it's not how you just normally would live your everyday life for
Right.
most. So yeah, the practice piece is so important. So
Absolutely.
important. And then that carries into postpartum too, when you're picking your baby up, and when you're, moving positions and all of that. So what what do you see most commonly? What do you see with postpartum patients,
Mm-hmm.
that you're working with them on?
Mm-hmm. So my postpartum patients, pretty much, not pretty much, every single one of my postpartum patients, I will work on their sacrum, which is like the back part of the pelvis. So the sacrum is what has to move out of the way. Let me just show you. I have a sacrum.
Yes, please do.
Yeah. Okay. So so this part of the body is the sacrum. So in order for the baby to come out, the sacrum has to drop back, right? So the sacrum needs to move. What happens when we deliver a baby, so especially vaginally,
Hmm.
but also if you start the labor process and then end up in a C-section, your pelvic floor still goes through the trauma of a vaginal delivery.
Yeah.
So you get that as well. But what ends up happening is, so that sacrum moves out and then it kind of gets stuck there.
Hmm.
And so then if we think about the sacrum and how it plays a role in the pelvic floor. So if the sacrum is moved away from the body, that causes all of the muscles of the pelvic floor to not function the way that they're supposed to, which
Yeah.
makes it harder to connect to them. So I will always work on them manually, especially in the sacrum. But then it's kind of just reiterating what we did during pregnancy. So working on breath and pressure management, that's
Hmm.
those two things are crucial postpartum. And then re-engaging in your pelvic floor and your core, getting those two parts of the body to work together to support the pelvic floor, the back, the core, all of the internal organs, all of that.
Right.
And then honestly getting you back to what you makes you feel like you. So if that goal is
Right.
running a marathon, like, we need to focus on your feet and your posture and all of that kind of stuff. If we're just trying to lift baby without leaking, then we need to work on that.
Yeah, and so many people are so. I think there's societal pressure too, but a lot of people are immediately concerned, like, okay, I'm ready to like get back to the gym, or I'm ready to get back to my workout routine, or whatever that is for them. I think that's great that they have those goals, but there's so much healing that we need to do before we go back to our routine at the gym or whatever. So, and it looks very different. It's still really hard work. It's something you still have to do every day, but it looks a lot different than like strength training and cardio and all of that. So, what are there specific like things that women can do postpartum, like in those first few weeks postpartum, to kind of like start the process of healing their pelvic floor and kind of working through that?
Yeah, absolutely. Um, so I would say the most important thing to get back and to start working on is your breath. So breath in the pelvic floor is so important because they work together. So it's like a pistoning mechanism with your diaphragm and your pelvic floor. And postpartum, your tissues have undergone a trauma. And so anytime there's trauma in tissues, that connection to the brain gets disrupted. So it's hard to find that like that pathway back to those muscles again. So what we want to do when we're breathing is a lot of people talk about a belly breath, but I prefer more of like a rib cage breath, because we want the rib cage moving side to side. So that way the diaphragm drops and it ascends and descends. If we're just doing belly, all of the air is going into the belly and we don't get as much of that descension of the diaphragm. And so we're not getting that coordination back. So working on that rib cage expansion. So what you want to think about with your breath is like an umbrella opening in 360 degrees. So the rib cage going forward, going to the sides, and going back. So breath, I think, is one of the most important things. The other thing is just being mindful of where you're putting pressure. So anytime we're like getting out of bed or lifting baby or lifting dog, whatever it is.
Car seats.
The car seats. Oh, yeah, car seats. Yes, especially those. Thinking about breathing out whenever you're doing that. So we're not putting more pressure onto the pelvic floor and making it work harder, because it is a time of healing that needs to happen. So the other thing that I would say is just gentle mobility. So, just moving your legs, getting your back moving, getting your belly moving, all in a pain-free range of motion. But your body wants to move, especially postpartum. So not doing anything strenuous, but just doing what feels good for it, getting some stretching in, moving through your hips, through your back.
Are there any like common issues that you see coming up when like menstrual cycles start to like come back, people get their period back? Is there anything that correlates with that? Like, do you feel like women experience more discomfort in the pelvic floor or dysfunction? I don't know. I just was curious.
So sometimes my patients will say that there does feel like there's more of a fullness with their periods postpartum. Some of my patients say they're better than what they were, but I think it depends on what your hormones are doing, because all of that stuff is tied into the hormone cycle. But I will hear that there's more of a fullness or a heaviness, which when the uterine lining like grows, there is some heaviness to that. And so if that tissue hasn't had a chance to kind of get stronger and heal, then you will feel more of that like pulling downward. Things just aren't where they were before you had a baby. So you can feel a little bit of that.
It's always interesting to look at it from different perspectives of like, again, the root cause of things versus just like, to be expected.
Exactly. Yes. I will say kind of in regards to like a hormone and like, so this is more like hormone less cycle, but I will have postpartum patients who are trying to get back to the gym and are still breastfeeding and get frustrated that they're not losing the weight, or they're like not able to gain the muscle. And I always try to educate them that this is still a time when your estrogen is very, very low, and estrogen is an anabolic hormone, so that's how we build. And so I try to educate them that like, you don't get discouraged right now because your estrogen is low, so it makes it harder for that to happen. So kind of in line with the periods, but again, knowing that this is not the time we're going to be PRing in lift or, just stuff like that, and how that impacts it.
If we're thinking about lifestyle, like we talked about lifting car seats, lifting babies, like what about like postures and occupations and stuff like that? Like what are some other things to be mindful of, like as women, to kind of, and men, I mean, it's important for men too, like we all have pelvic floors, but as women, like things that we should be mindful of, that could affect our pelvic floor, or maybe issues that again seem brushed off or brushed under the rug that like we should really be actually concerned about and like digging into.
Yeah, so posture postpartum, what I see a lot of is in pregnancy, your rib cage has to move. So a lot of time we end up with a flared rib cage. So the ribs are coming out a little bit and then they'll be going out to the sides, which that posture can remain postpartum. And so what that does is that posture tilts our pelvis forward. And so we can get a lot of discomfort through the low back. But then my patients will also notice is that the mom pooch or, that kind of thing can actually be a result of that kind of tipping forward posture.
Mm-hmm.
So if we correct the posture, and it's not just like stacking your rib cage on top of your hips, like we need to work on that rib cage mobility. So that way it's in the appropriate position to be able to have your spine be in the right position to allow that.
Yeah.
But then they'll also tuck their butts under as a way of doing that. So a lot of moms squeeze their butts as a way they're trying to find stability because we've lost our core. And so not clenching your butt is a big one.
No clenching. Let it go. Let it go.
And it's hard. It's hard.
It is hard. It is hard, especially if you don't have the strength and the stability. If you're not working on that.
Exactly.
Super hard.
And for those people, what I would say is just become aware.
Mm-hmm.
We can't change something we're not aware of. So if you don't know if you're clenching your butt, just try to pay attention.
Mm-hmm. Yeah. Yeah, I know we've talked about this before, and in fact, we were just talking about it before we started recording, but our system, our health system in the United States is just not set up for moms and women to, have great access to pelvic floor physical therapy. And it can get expensive. And if it's not something you're really aware of beforehand, and then afterwards, after the fact, you realize, oh, I actually do need to do this, but you don't have the money or whatever the case may be.
Mm-hmm.
I don't know. Do you have tips for women? One, maybe, I don't know, tips to gain access, or just programs or things that they can do at home to kind of fill the void?
Yeah, that is a challenge.
It's unfortunate.
It's very unfortunate, and it is a challenge. If you can find somewhere in network that can make things a little bit more accessible, even with an in-network provider of some sort, it can still be a decent amount out of pocket. So a lot of places there are people who will offer like virtual visits where you can get education. It's not the same as like a hands-on experience. Mm-hmm. So usually the virtuals, or if they have an online program of some sort, they can be beneficial just to get an understanding. And again, we can't change something we're not aware of or we don't know. So just finding that information will be beneficial for you. If somebody's not able to come in to see me, but their goal is getting back to exercise or something like that, I will always recommend a program called Evlo Fitness. Mm-hmm. It's Dr. Shannon Ritchie, and they are all physical therapists that work for her, and she has a prenatal program and a postpartum program. So that I trust in the sense that they are educated on the body, and they have certifications in like the prenatal and the postpartum as well.
Yeah.
So
that's a big thing. Like there's so much out there.
There's so much
out there on TikTok and Instagram and all the things. And it's hard to figure out, like, is this the right thing? Is this, credible? Should I trust it? Mm-hmm. So yeah, that's a great resource.
And what I would say, if you are doing some sort of online programming for exercise or anything like that, really tune into your body and listen to your body. So it's going to tell you, your tissues will tell you when they've reached their limit. If you're starting to have leaking, if you're starting to have any kind of pain, back pain, hip pain, pelvic pain, if you're starting to feel pressure or heaviness, anything like that, when you're doing these workouts, those tissues probably aren't ready for whatever you're doing. Mm-hmm. So listening to your body, tuning into that, not just pushing through this. This is not a no pain, no gain type situation.
We
This
did
is
that in labor, right? Okay, no gain in labor.
exactly for the healing journey. That's not the same story. Well, so this is not normal. Okay, those things are not normal. You don't have to be peeing yourself just because you're
While
jumping.
common, not normal.
Common, not normal, and typically a sign that your body's not supporting itself the way that it needs to. So if you are noticing that in the exercise programming that you're doing, try modifying and finding an exercise that feels challenging, but you're not getting those same symptoms with.
Yeah. Yeah. Okay, well, before we wrap up, we've not talked about C-section,
Mm-hmm.
which I think is a huge one because literally moms have C-sections and they're like, okay, see you in 6 weeks. You know, you might get a phone call from somebody checking in on you, but like there's literally no guidance on how to properly heal and what to watch out for and what to do in, 6 weeks, 8 weeks, 3 months, down the road to, rehab the tissue and that area. So what advice do you have for those moms?
Yeah. So C-sections are common. They're more common than, probably we would like for them to be,
Right.
but they happen. And I always try to reiterate that to my patients to know that it's a possibility. Like, obviously that's not the goal in birth.
Yeah, we don't want to spend a ton of time like obsessing over that if that's not our goal, but we do
Right.
need to be
Aware that,
prepared.
yeah, aware that it's a possibility.
Mm-hmm.
Now, if that is the journey that you're on,
Yeah.
your pelvic floor is still affected by a C-section. So,
And by pregnancy,
oh, absolutely.
you know?
Absolutely. The entire process of becoming
Right.
pregnant, being pregnant, the delivery, all
Yeah.
of it is impacted. And so we think that the pelvic floor is spared with a C-section, which again is not true. And also, the abdomen is so important for supporting the pelvic floor and those deep core muscles. So if we don't ever work on that scar tissue, if we don't ever reconnect to those lower abs, you're not going to get the same support that your body needs and wants.
Mm-hmm.
The other thing with that is that scar tissue can adhere to the bladder behind it and cause scar tissue there. So if we end up with like urgency, frequency, that kind of stuff, if we work on that scar tissue a little bit, that's going to significantly improve. So these are all things that can happen with a C-section, and which is why it's still so important to be seen and be treated for that.
Yeah.
So what I would say is if you end in a C-section, again, the same thing that I would tell somebody who had a vaginal delivery is start working on your breath. Okay, so we want the belly, we want the rib cage moving. We want to start moving the abdominal tissues because they just went through a trauma. They, cut through 7 different layers when they do a C-section. So there's a lot that happens with that.
Which a lot of people don't realize.
Mm-hmm.
There's scar tissue with each layer that
Absolutely.
we have to go through. Yeah.
Absolutely. And so working on your breath, pressure management is just as important. The difference between a C-section and a vaginal delivery is that like you had a massive abdominal surgery, and so they cut through your abdominal muscles. So that strength that you have, if you even think about laying down to sitting up, that is going to be so much pressure going through the abdomen. We don't want to do that. So working on good like bed mobility mechanics, breathing out when you're standing up, breathing out when you're pooping. Post C-section poops are scary. So are even
they're scary. They're scary no matter what.
Yes.
But yes.
Yes. So really paying attention to your breath. And then the other thing that I would say is make sure you're touching this tissue.
Yes.
So a lot of times it can be a mental component of not wanting to touch the scar. And so for those people, what I always recommend is touching just touching your belly. Okay. We want the entire belly moving. So just gently kind of moving tissue side to side, even if it's not directly on the scar. But then as soon as you can tolerate, start gently putting pressure through the scar, getting that tissue moving. Nothing aggressive by
Aggressive,
any
right?
means. It's still healing, but the sooner we start giving input to that tissue, the sooner it can start remodeling and will cause less stiffness through that area long term.
Yeah. Is there an ideal time frame to start doing that? And also, is there an ideal time frame for like to start seeing a pelvic floor physical therapist? If you weren't already seeing one
Yeah,
during pregnancy.
sure. So your doctor will clear you for activity at 6 weeks. So that's typically when we see patients, but I have seen a C-section mom postpartum at 3 weeks.
Mm-hmm.
And that doesn't mean that we did an internal.
Right.
But we started working on her abdominal tissue and we started working on scar mobility even
Yeah.
at 3 weeks. So
Yeah.
getting this tissue moving as soon as you can, start laying on your belly can even be a good way to start getting feeling back into this tissue.
Yeah. Yeah, and
So
I think what a lot of people don't realize too is all that scar tissue can lead to trouble getting pregnant later or trouble during, complications during subsequent pregnancies and stuff like that. So the earlier you can do that, the better.
absolutely.
Is there any
Absolutely.
point when it's too late? Because I know
No,
that we're going to have moms listen to this. They're like, I had a C-section 3 years ago and no one told me this.
no, absolutely not. I have treated patients in their 60s who have had C-sections and we work on their scar.
Mm-hmm.
So obviously it would be ideal to start working on it,
Right.
sooner. But my patients who are in their 60s and their 70s, who we start working on their abdominal scars, nobody ever tells you to touch your scar.
Right.
Nobody
Yeah.
tells you that ever.
We're like, make sure it doesn't get infected.
Right.
Make sure it's not oozing or,
Right.
red.
Right. Exactly. No,
But,
nobody.
yeah, it'll heal and it'll be fine and you don't need to worry about it.
Mhm. Exactly.
Yeah.
And it's amazing, my patients that are older who have had C-sections, and we start working on it and they're like, it just feels like there's so much more movement in it, or it doesn't feel so tight, or
Mhm.
like their bladder's not as irritated. So you can make
Right.
changes in scars even years later.
Yeah. So crazy.
I know.
So cool.
The body wants to heal and it wants to move.
Yeah.
So
Yeah. Such cool work. Well, this has been amazing. I'm
thank
so
you.
glad we were able to make this work and for you to come on. I know that a lot of our listeners are going to have their eyes opened and probably going to be having lots of questions. A lot more questions or, personal things that they're experiencing, wondering if it's, related and if, something like this could help them. So, yeah, where can people find you? You can plug away for social or whatever.
Yeah, so I work at a clinic called Empower Your Pelvis. We have a clinic in Kansas, in Overland Park, and then we also have a clinic in Missouri, in Lee Summit, so in the Kansas City area. So you can
Yeah.
follow us on there. And if you have any questions, you can reach out to us. We're always happy to do a consultation and see if what you're going through is something that we can help with. It doesn't have to suck because you're a woman. Like,
Yes.
yes, it can get better. And everything that we talk about in here, I mean, obviously it's weird, right? Like pelvic floor stuff is weird. But until we start talking about it and normalizing it, there's going to be this feeling of guilt and shame around it. And that's the narrative that we're trying to change. We're trying to
Exactly.
get women to feel empowered in their bodies and to want more for ourselves. We want to live a fulfilling, amazing life and do all the things that you want to be able to do without restriction.
Absolutely. Yeah. Yeah. So keep plugging away and pushing on and asking questions and don't
Yeah,
just settle for it's just the way it is.
right. Exactly. We're out here. You gotta keep asking the questions.
Absolutely. Absolutely. Well, thank you so much. And we will chat at you guys next week.
Sounds great. Thank you for having me. This has been so great.
Yeah, so fun. All right, bye everyone.